live here, LENSEC Live, and What's Your Perspective show. And I am Neil Haley. I am part of the Inside Sales team and also What's Your Perspective radio show host. And I am with Keith Harris of LENSEC. Keith, how are you? And how are
doing
things?
Great.
That's awesome.
We're doing great. Yeah, everything's looking good here.
Absolutely. I'm excited about a lot of the guests we have lined up the next couple of weeks. We talked about that last week on the show. And what's really amazing about the guests that we're going to have on the show are they're going to really provide us some great tips and things to learn about in physical security in certain verticals. And our guest today is Sheila Stine, and Sheila is a healthcare attorney. Sheila, thanks for stopping by. What's your perspective? How are you?
I'm great. Thanks for having me, Neil.
Absolutely, Sheila. Can you tell me a little bit about your background and your experience in law, especially healthcare law?
Sure thing. I've been a healthcare lawyer for going on 25 years now. I've represented all different kinds of healthcare providers and hospitals across the spectrum. I'm currently working for a prominent electronic medical record software company that provides electronic medical records.
Oh, very interesting. And from that process, healthcare's changed a lot, hasn't it? In the way the attorneys look at it, especially on one side versus the other side of the bench in certain ways, right?
Absolutely. Healthcare is constantly changing, especially the regulatory environment. It's really hard to keep up with everything, and it's always a moving target. And of course, the technology side of it is a huge piece of the business.
Absolutely.
Yeah. So,
all right, Keith,
the technology side of it. I'm sorry, Neil, go ahead.
No, go ahead, Keith. Go.
I was going to ask you, Sheila, in terms of technology updates that are going on in healthcare administration, what are some of the things that you're seeing?
I think the biggest thing impacting healthcare right now in the technology sector is cybersecurity. Obviously, healthcare providers may not even realize this, but you're an active target for bad guys. The data that the healthcare providers maintains has actual real value, a lot of value on the black market. And so healthcare is actively being attacked with viruses and malware and hacking, and even now ransomware is impacting healthcare, phishing emails. And of course, the other cybersecurity threats just have to do with your own, the way you protect your own environment, with the way you're controlling your data and, your technical, administrative, and physical controls over that data.
And, when you talk about that whole process of cyber, how much more have you seen cyber problems, especially during the pandemic, just in cybersecurity alone, looking at specifically enough how, criminals are working differently than they were before the pandemic?
There are active cyber threats directed to healthcare because of COVID. There's a huge number of fake websites out there that have, for instance, COVID in the name of the website, or you may receive phishing emails that contend that there was a phishing campaign out that said there was going to be a national quarantine. That was malware. There's all kinds of lures out there that have to do with COVID-19. Also, the bad guys are actively exploiting a lot of the healthcare providers because, honestly, some healthcare providers scrambled to rapidly bring their workforce remote and to start engaging in telehealth or telemedicine in a way that they hadn't done before. The bad guys are aware of that and have really been actively exploiting some of the new setups.
And
in fact, they're one of the resources that I've provided Keith that he may want to bring up on the screen is an alert that the Homeland Security Department, along with the Cyber Information Security Agency, CISA, put out describing some of these very specific COVID threats that are impacting healthcare.
Yeah, when I start thinking about how quickly and how smart they are, it's crazy.
Yeah, it really summarizes a lot of these attacks, and these attacks aren't limited to healthcare. These just happen to be some of the ones that are really, the Homeland Security felt like it was important to let healthcare providers know about.
Absolutely.
And phishing is
always... you talked a little bit about phishing and text message phishing is on the rise right now. A lot of people are getting phished via their phone. As a matter of fact, I think I had one just a few minutes before this call started. I had one that came up. It was really weird.
Yeah, they're very sophisticated, and that's why it's very important for healthcare providers and anyone in anyone in business, frankly, to teach their workforce to recognize what a phishing email looks like.
Definitely. And when we talk about, we've talked about cybersecurity, but really a lot of our focus, definitely in LENSEC, is the physical security side. And tell us specifically enough what you see, the kind of things that you see in physical security regarding the vertical market of healthcare.
Well, healthcare is very, very heavily regulated, and it's regulated under a number of laws. HIPAA is a primary driver of the regulations of physical security for healthcare, and it is very complex. In addition, there are laws under each state. There are federal laws like the Federal Trade Commission that may apply to some of the non-healthcare data that the practices may be handling. And of course, every state in the nation has a data breach notification law. So healthcare is regulated left and right with respect to what's required for physical security. And if you like, I can talk about some of those regulations, or what are some of the best practices for physical security, whatever you like, Neil.
And I kind of, Keith, if you have a question, I'll let you go, but I kind of want to lead into specifically enough. Take us there. Take us to specifically enough, a hospital first, because there's a lot of different vertical markets we can look at involving healthcare. There's the hospital, and there also is the doctor's office and an urgent care type of smaller environment. So when we talk about a hospital, the security, what do they focus on in security? What is that goal of that security team when you talk about specifically healthcare?
Well, there isn't, I think when you look at physical security for the various types of healthcare lines of business, the regulations apply equally to all of those healthcare facilities, but they're scalable and they're dependent upon the complexity and the budgetary resources of the organization. So how you approach your physical security in your hospital versus your small one-doc practice is going to be quite different, but we're going to be talking about the same kind of controls. And obviously with physical security, the very first thing that you're going to talk about is access to your facility itself, whether that be the internal, getting into the building or getting within the building itself. And so you're going to be talking about the methods that you're going to be protecting that security and who is authorized to handle or enter or exit certain areas of the building or internal rooms. And how are you going to be monitoring that, whether that be with software like LENSEC provides with your cameras and video surveillance, or with badge readers that are connected to software that say someone has entered the medication room, for example. And
that's one thing that I wanted to bring up, because you were talking earlier about cybersecurity and some of the malwares and Trojanwares that are out there. This is actually like a sneakerware. This is people that are actually physically entering in and engaging in facilities that they may have just helped themselves to the back office while people are away at lunch, and they're accessing information. You have to really be cautious about that and keep things on lockdown and keep a close eye on your environment and the assets that you have. Not only the assets you have, but the people that are there as well. You have to keep it all safe and secure.
That's right. And the best way to approach that, no matter what size or complexity your organization is to have a formal facility security plan. And that it just documents what the expectations are for the facility. And that could be anything from door locks to warning signs to having surveillance cameras, having alarms, control tags and engraving on equipment, things like that, your actual ID badges or different colored badges, depending on what your role is, or if you're a visitor, you're going to have a particular badge or be escorted. And even whether you're going to have security patrols on your property, like security guards.
And I think your office, Sheila, is the sharing space with another organization. So you have multiple organizations within the same building. So you have a lot of people moving through hallways and around common use areas also.
Absolutely. At eMDs, we share the building with a number of different organizations, some of which are not subject to the same kind of heavy regulations that we are. So not only is planning and documenting critically important for physical security, but the culture of awareness and compliance with our staff is also very important. So training people how to recognize a bad actor or somebody who may just be lost, and actually taking the uncomfortable step of stopping them and asking them, hey, can I help you find where you're going?
You know, and I think about where they're going and all those different things, figuring out, sometimes it's too late. You look at specific things, Sheila, and somebody infiltrates certain things, like takes certain medications or is in an area that they shouldn't be in. For example, the maternity ward, they're very highly secured where only certain people can go in and out of those areas, but other parts of the hospital is different. So as a security team, you have to identify which ones are more of a risk, right?
Mm-hmm.
And that's important to look at.
Yeah, it's interesting now with COVID how facility access has changed dramatically depending on the kind of provider you are. For instance, ERs, many ERs are overwhelmed and they're not even allowing visitors to come in. They've just shut down access unless you are an admitted patient. But on the other end of the spectrum is maybe your 1 or 2 doc practice who shut down working from home, and nobody's watching that office. So that increases the physical security risks for them while their office is sitting there with nobody coming in and out regularly and watching it. Increases the risk of theft and increases the time necessary maybe to get to network equipment if something actually happens.
Absolutely.
It's sad that we have to think of all these ways to prevent people from doing things that they're not supposed to do. But it's kind of the nature of the culture that we're in. And I'm thankful we have technology to help us bring all that together and manage it a little bit better. Is there any management techniques that you'd recommend for people on bringing their physical security in, and what they need to be thinking about on a broader level in order to make their footprint more secure?
In healthcare, risk management is driven, again, by heavy regulations coming from a number of different areas, whether it's HIPAA or the joint accreditation organizations or the Affordable Health Care Act. And so risk management is actually legally required in this industry. And, when we talk about risk management, we need to understand what that means. And to me, that means looking at reasonably anticipated threats to your physical security. What is likely to happen in your physical environment, and what would the impact be if it actually happened? And so we're going to be anticipating those threats, figuring out what happens if that risk actually comes to fruition, and what can we do now in advance, knowing that that's a reasonably anticipated threat, to mitigate the threat, reduce the risk, or even in some circumstances, it may be appropriate to accept some lower risks. And some of the things on physical security that you're going to be considering are things like your backups of your data, or your backups of your audit log of your movement of your people and your equipment. What are you going to do when there is an emergency? How are you going to bring your business back up online if there is a flood or a tornado? How are you going to train your people? What are the expectations and how frequently are they going to be taught? What's your protocol for reporting risks and escalating it within your organization? And finally, one of the really important risks to consider with physical security is your insurance. Do you have insurance for physical property damage or even cyber risks that are out there that can impact your property?
And so hospitals, a lot of times, how much risk insurance do they have to carry regarding their security? No.
There's no, to my knowledge, no requirement of a minimum level. It's just good business. It makes good business sense. But if you consider the cost of, for instance, a data breach, the cost of a data breach, I think, runs sometimes in the hundreds of dollars per record per individual. So if you have a database with 10,000 people impacted, you can see that the bill for that is going to be very, very expensive. So you have to consider how much data you have, what's your risk if you have that sort of impact, and then decide what you can afford with respect to insurance. So it really varies across the board.
How does that differ from more like the doctor's offices and the clinics, a smaller operation? Where do you see them sitting in their planning for managing their risk?
Well, I always like to think about it this way. Doctors and nurses and healthcare providers and professionals are not security experts. Historically, they have not been technologically savvy when it comes to their IT security, and they very largely rely on third parties or maybe a staff member to handle their physical security and their other technical security. And so it's really, really important for those smaller providers to make sure that their vendors are, that they've done the due diligence, that they're not dealing with a shoddy vendor that is maybe unfamiliar with what the requirements are and maybe not taking all the best practice steps for a provider of that size.
You know, it's interesting, Sheila. Now we talk about how important security is in hospitals and healthcare facilities of certain doctors' offices, urgent cares, things like that. But the problem is that security has to follow certain rules because of HIPAA. So kind of explain that to us, because that's something that kind of throws the monkey wrench of really wanting the best security at times, because HIPAA has certain privacy laws that makes it more difficult to expose certain security assets, right?
You know, the first thing I would say is that just because you are compliant with HIPAA doesn't mean that you have a best practice security environment. HIPAA should be considered the floor or the minimum of what is required. And it's the minimum of the legal safeguards that are administrative, technical, and physical in nature to protect not only the confidentiality of the information, but the integrity of it and the availability of it. So those are just the minimum basic requirements. You know, you can look to organizations like the National Institute of Standards and Technology and, you know, try to determine some of the best practices. I think another resource, Keith, is a white paper that the Department of Health and Human Services put out that describes what those minimum physical security controls are. I've supplied that for your audience today to just know what the minimums are. But again, you really should be trying to do the most you can do with what you can afford, because the bad guys have unlimited resources and they are actively targeting you. So it's important for a provider of any size to adequately budget for and consider what the reasonable anticipated risks are for their organization.
And we'll make these resources available in the comments below after the event is over. But we're looking here at some of the physical safeguards. You've got facility access controls. It looks like a standard that's lined out here. And these look like they're coming from Department of Healthcare and Human Services. Is that right?
Yes, this is the organization that regulates HIPAA and has put this white paper out as an educational material for providers to know what to expect under the HIPAA regulations. What are the minimum required or otherwise addressable standards that the regulators expect them to have? It's by no means an example of best practices. It's just, again, the minimum standards.
Now,
Right.
I was trying to bring this question up, Sheila, regarding HIPAA and the fact that if you want to use lots of video surveillance, I have been in many hospitals since I've been in this industry, and I feel that they're not covered enough video surveillance wise. Is it HIPAA the reason? Because they're concerned of privacy issues that you don't see as many cameras per se that you would see maybe in a school district or other facilities?
You know, I think it's probably more an issue of resources than it is HIPAA issues, because HIPAA certainly permits video surveillance under certain circumstances in the patient healthcare setting. So I don't see the regulations as an obstacle to doing that, but healthcare is strapped for resources. Their funding is difficult under the federal financial participation that many hospitals rely on. And so it's just a matter of juggling. I mean, you have so many different resources you have to throw at IT security, and video surveillance is just one of them. I think it's a very important and very useful tool for the healthcare industry, hospitals, and even smaller practices to have things like video surveillance, because it offers an excellent view, an auditable view of what's actually happening in, for instance, your medical records room or your drug dispensing room, or even your waiting area, to see if somebody becomes hostile or violent, or if there's some sort of criminal activity. It can be very useful to law enforcement to have that video to support what's actually happening there.
Okay.
I also think that it changes the public's behavior a little bit, knowing that they're under surveillance.
And I'm shocked, like some of the places in Pittsburgh, the cameras, how old they are and how outdated and archaic some of the stuff in Pittsburgh. Might be different at different hospitals, but I've noticed that looking at cameras, looking at specifically how things are done. But later in this interview, we will kind of touch upon the new normal. Actually, I guess I should have, when I heard that word the first time, registered that, Keith, and I would not be sitting here right now, because you know how much that is worth now. That URL is like $1 million.
I heard
The new
a
normal,
great
yeah.
story this morning of law enforcement using surveillance cameras to identify and prevent what was about to be riotous behavior that would have been very damaging to personal property. They used that surveillance to identify the culprit and stop it before it happened. And that is no different than what can happen in a healthcare setting if appropriate personnel are monitoring what's going on those cameras.
Well, a lot of people have said that video surveillance is more reactionary than it is proactive, but I disagree. I think if you've got the right resources in place with event notification and the right video analytics, face recognition, even license plate recognition, then you can have a more proactive stance. Yes, it's more expensive and you pay for it. But putting some of those measures in place can really help to create a nice proactive stance that allows you to prevent security issues from occurring. They can stop the problem before it happens.
Agree. And in the case, when we're dealing with the case in Minnesota, that video surveillance gave the whole process, not just what a bystander filmed. The surveillance cameras outside of the stores where they filmed everything was able to piece together everything to show what truly happened. Because if they didn't have all that, so that's why it's important, in my opinion, to have a lot more cameras in out there for video surveillance, especially in facilities, different places like that, so you can catch those things before it's too late. For example, we're talking about COVID-19. But God forbid there was something that was some sort of a terroristic act of some sort that brought something in that could, harm so many people, and yet they were able to figure it out. So I think that everyone needs to be on guard, and it's a proactive thing, video surveillance. Now, Sheila, when you talk about specifically enough the HIPAA and all that stuff, so it's very good to know that HIPAA does not deter using video surveillance, because you think about it, that when we're trained in HIPAA and we look at things and we sign these HIPAA things, we think ultimately it's only our concern, meaning the patient. That's the person who's being protected most by HIPAA. And that's not true, is it? From what I'm hearing you now, because if it was just the patient's concerns, then some of these other measures wouldn't be in place in security, right?
Well, HIPAA was designed as a measure to protect patient privacy, but it also is designed as a measure to permit treatment and obtain payment and conduct hospital operations in consideration with, to balance the rights of the patients.
Okay.
I have a question for you in regards to the pandemic. And my question is there anything there that's changing how some of the security protocols that we see in doctors' offices and medical clinics, in hospitals across the board?
Absolutely.
Is there anything on the change?
Yeah, and I think the first thing that I would say is the medical community is under trial by fire. I think largely the community was not set up to have their workforce working remotely. The culture is to have people present in the healthcare, typical healthcare office or hospital. And so having so many people move remotely so quickly was very challenging for the industry. It's also important to consider that with the shutdowns and with the cancellations of elective procedures and surgeries and people's concerns about going into the doctor for routine wellness checks, that the budgets of healthcare providers have been impacted by COVID. I think I read a statistic that something like 67% of healthcare providers have had a financial hit of about 30% of their normal revenue in the last couple of months. I think that is beginning to turn around now that a lot of people have moved towards telehealth and some of the shutdowns are being lifted. But, they have a budget to work with. like everybody else does, and that COVID has impacted their ability to spend on everything, whether it's payroll or IT security. I think that one of the issues with remote work also is bandwidth. And so is your system set up to handle the bandwidth of having your entire workforce trying to use a virtual private network to get in? And of course, like we mentioned at the beginning of the conversation, there are active cyber threats related to COVID in the healthcare industry that are making IT security very challenging right now.
Absolutely. And that's scary to know about the whole cyber thing, but again, the whole thing. So if you're thinking that new normal, I think that the biggest thing, I was talking to a healthcare professional, talking about gowns, talking about specifically how many times you clean things up. And you're seeing that legally, right, as well with COVID-19, right? That certain facilities have to follow these. Is it a law now?
There are many infectious disease control laws out there that have been in place and may have been updated, especially with respect to CDC guidance. But infection control has always been at the forefront in the healthcare community. I think that we're probably seeing maybe more unique and different ways of trying to do with what we can with when protective equipment is not available. But I've even seen recently newer technology to help with infection control, like electrostatic sprays that may be utilized in the healthcare industry in ways that they haven't before. So yeah, I think it's always been at the forefront to control infection, but we're seeing regulations and guidance trying to improve that every day.
One of your favorite topics, contact tracing. Tell me about contact tracing.
Yes.
And it's okay. Nobody's judging you here. I want to hear about it. Tell me what you're thinking about that.
I'll just preface this by saying I have a young daughter who's socially active on social media. She's a social media influencer, and she was saying how exciting it is to have COVID contact tracing. And I was explaining to her some of the risks to you as a person with your privacy when your movements start being tracked by businesses like some of the social media giants or even some of the public health authorities, because I think they can be misused. And a lot of the privacy nerds like myself are engaged in debate about how to appropriately use contact tracing to help the public and at the same time not violate your personal privacy and freedoms.
Wow.
So I will not be downloading apps to describe my movements with respect to COVID anytime.
Now, so
it's a big topic.
Yeah.
This topic, the other topic out is the grants that could be available for contact tracing, especially video surveillance, which again, a lot of people are disagreeing with. Again, our country's divided in many ways, but as an attorney, what are your concerns regarding that they're going to use video surveillance in a way to, I guess, eliminate some of our freedoms? Do you feel that there'll be lawsuits and stuff going?
I don't know about lawsuits, but we have to understand that public surveillance is out there already. It's happening in every major city already. So you're already being monitored when you go outside on a public street. And my opinion is you don't have an expectation of not being filmed when you are out in public. Now, when you start talking about monitoring my behavior in my home or monitoring my movements in a way that is not afforded as a governmental right, that's when I start having concerns. But I don't have an issue necessarily with utilization of technology to protect the public in a way that is fair and reasonable.
Okay, interesting. Keith, anything else to add? That's Sheila.
Yeah, well, we've been seeing a lot of the tracing issues come up out of China and some other more restrictive countries. In a place like China where the government manufactures and makes all the phones, they pretty much do whatever they want to do in terms of tracing their subjects and tracing their citizens and monitoring their movements. But I think there's a big difference there in what we would and should see here within the United States, where we have more civil rights than some more restrictive countries have.
Yeah, it's an amazing and unique time in civil liberty circles right now to talk about how to balance our constitutional rights and freedoms in the country that we're blessed to live in versus protecting the larger public. So there's a lot of debate to be had on the issue for sure.
Well, Sheila, I appreciate you stopping by and giving us all this great information regarding physical security and cybersecurity in healthcare. Is there anything else you'd like to add before the end of the show?
Yeah, I would just recommend those in the industry to really focus on the risk assessments, and especially with their data backups. If I see anything in this industry, it is the practices that aren't protected sufficiently with physical controls and technical controls, and are hit by the bad guys. They're hit with ransomware, or they're hit with malware, and they're wiped out. And just prevention is your best medicine in this environment.
Very good. Well, Keith, it was a great guest. Always exciting things, and we have some exciting guests coming up next on What's Your Perspective, don't we, Keith? Next week.
Yeah, next week we're going to have Nathan Parr with the Cool Solutions Group. He is actually an expert in church facilities, places of worship, and he's going to provide us with some perspective about how many of the religious organizations are working to get back together to meet publicly. They have a lot to think about, and I'm sure he's got some pretty great topics and best practices for us.
And looking at before that with certain shootings and things, it's interesting to discuss those things, but also the new normal when it comes to attending church. As Catholic churches, I think, are going to start to open up in Pennsylvania very soon, so especially Pittsburgh. So good information to discuss, and will COVID be passed on more in those environments? So looking forward to that guest. Everyone, we already told Sheila, can we find information on you, or is it best just to kind of message us at LENSEC if you have questions?
Yeah, I would be happy to answer questions if you want to reach out to Keith O'Neill. Mm-hmm.
All right, awesome. Remember, always, if you missed this broadcast or starting to finish up the broadcast, go to lensec.com/live, and you can check out all of our other live shows, and we're going to be available on different podcasts. But you can follow us at LENSEC on Facebook, Twitter, Instagram, LinkedIn, all those places, as we're not just live right now on Facebook, we're live on LinkedIn and YouTube, all of those places. But go to lensec.com, and we can answer your questions right now. So I appreciate it. And it was an awesome LENSEC Live, What's Your Perspective show, and I'm looking forward to next week. So take care, everybody.
Thank you. Thanks.